There are many pills that have been offered for the treatment of Peyronie's disease over the last couple decades, including vitamin E and colchicine, tamoxifen, Potaba, and then there are a variety of nutraceuticals that have been offered as well. None of them have been shown in trials when they've been done to show that there's any benefit over taking a placebo. And to my knowledge, there's no trial showing any benefit with any of the nutraceuticals or any of these over-the-counter remedies. More recently, there have been some animal study models which have looked at pentoxyphylline, L-arginine, a derivative of L-arginine, L-citrulline, and the PDE5 inhibitors, the Viagra, Cialis, Levitra medications, which have suggested that they may have some beneficial effects because of a anti-scarring, anti-fibrotic effect because of elevation of nitric oxide in this tissue. Now, having said this, it makes sense in the animal model because of the benefits that we're seeing when you induce Peyronie's in the rat, for instance, but it has not been shown in humans. The PDE5 inhibitors, also known as the phosphodiesterase type 5 inhibitors, include Viagra, Levitra, and Cialis. These drugs were shown in an animal model study of Peyronie's to potentially have some beneficial effects, at least to reduce progression of disease, and may actually result in some regression, resolution of scar tissue once it's established, again, in that animal model. No good human studies have been done as of yet, but they do make scientific sense. And so it may make some sense to use these agents. The problem with them for me is that they're very expensive. And so to take one of these pills every day can be quite costly with really no strong evidence of benefit. Now, one area that I do use these drugs are in men who have Peyronie's and who have some erectile dysfunction, because there's no doubt these drugs will help with mild to moderate vascular erectile dysfunction. And so getting better blood flow will certainly enhance an erection and maybe make it more possible for that man to engage in successful intercourse. There are many mail-order products that have been touted to be beneficial for Peyronie's disease. To date, none of them have been shown to be beneficial, but there are some potential dangers. Those would include that you're not really getting what you're paying for. This would include the phosphodiesterase type inhibitors as well. Studies have been done that have shown that when you may order, let's say, a 20 milligram tablet of Cialis, in fact, you may be getting 1 milligram of it, or 100 milligrams, or maybe none of it, or something else that may be dangerous. So I would caution anybody who is thinking about ordering their medications over the internet to think twice, because indeed it may not be what you're hoping to get, and it may be actually potentially dangerous for you.